My name is Maya Pimentel. Today we have something a little bit different. I'm gonna show how to inject estradiol. I've noticed online there's a lot of videos that show you how to do this but don't include a person being injected, so this will be a real demo. I'm here today with Tim, who is, oh, I forgot your title, I'm so sorry.
I'm a physician assistant.
A physician assistant, and you work with trans people specifically.
That's right. I practice gender affirming care and LGBTQ sexual health.
Okay, so Tim's the perfect guy to help us do this. Tim is going to instruct us, and then I will do as he says.
All right. So today I'm just going to narrate how you would draw and prep the medication before the injection.
Awesome.
All right. So first, clean hands is desired. So you can wash your hands on or use sanitizer.
Okay. So that was step one.
So it's good to kind of lay out all your equipment ahead of time so that with clean hands you are only kind of touching the necessary equipment. So here we have a syringe, a alcohol pad, Band-Aid, your vial of the estradiol, 2 needles. One is to draw up the estradiol, the other one is to inject. We draw up with the pink needle, 18 gauge needle, and we inject subcutaneous space in the abdomen with the orange 25 gauge needle. It could range from half an inch to 5/8 of an inch. First step is to open your alcohol pad, and as you're holding the vial, to clean that the top space there. This is to avoid contamination.
And then the first time I did it, I just kind of wiped the top, but a different nurse said you can like really get in there, get the side, cleaning it.
Exactly.
Like
right. Mainly because, you know, a lot of the time people do hold the top of the vial and just everywhere else. So really ensuring a sterile technique and cleaning any part is good. The more rubbing, the better, because then you're really ensuring that there's no bacteria or anything that can kind of contaminate it. So now after it's there, make sure it's completely dry before you then poke, because drying really allows for the clearance of bacteria and viruses. So the next piece is now to prep your draw syringe and needle. And so take the syringe, appropriate syringe. This is a 1 cc, 1 milliliter syringe that is appropriate for volumes that is less than 1 milliliter. Anything greater than 1 milliliter, I recommend using the 3 milliliter syringe. It is actually packaged in a way that you are able to pull it out at the end. So near the end of the syringe is where you're able to actually kind of open it so now as you pull out the syringe first, at this point, pull out the syringe now, and then you are now opening the needle the same way how it's packaged, is that it has a very easily separation, that you can separate the packaging. You're going to insert the syringe onto the needle, and there is a twist motion where it locks in. So make sure that this step is important here to lock, because this ensures that the medication will actually enter the syringe appropriately without spilling.
The first time I did it, the needle fell off and it was very messy. So I definitely recommend.
That's right. And so actually be very careful with syringes that are not locked, mainly because then that will fall out, and then mainly also because the medication is viscous, that injecting could potentially actually separate the two. If you don't get a prescription for a locked syringe, ask for one. If you don't, recommendation is then to really be careful with slowly injecting it. So the next part is you can remove the cap of the needle, and then you are then also going to pull up the amount of volume that is prescribed. And so in your case is 0.18 milliliter. And so you're going to take the vial, and then you are going to poke the vial. And how you actually holding the vial could be that you can kind of tilt it upside down, and then you can just kind of gently push it in onto the vial, that kind of rubber space.
And then you said to always try to poke a different spot, right? Because we don't want to...
Right, because if you poke in the same spot, because the needle is so big that it actually can leak out. So then that's great there. Make sure that the level of the medication, estradiol here, lies on top of the bevel needle, right? So then, because you're trying to get the needles to be in that kind of viscous space. You know, you don't want to be on top of the where air is, right?
Yeah.
All right. So now, with that, you push in the airspace that you have created in order to create kind of this positive pressure. Once you the air in, you're going to try completely all the way in, and then you're going to start pulling down to the volume that you have just pushed in. Make sure that you check with your own eyes to ensure that the needle is in the viscous space.
So many bubbles, Jesus Christ.
All right. You might generate bubbles, and that's okay for now.
Okay, so should is that too many bubbles?
Yeah. No, this is still fine. This is there's going to be a small amount of bubbles that are minute, minuscule, and this is completely okay. The bubbles that are not okay are that maybe occupy more than 0.0203 milliliter. Good for now, and then you're going to actually now pull completely out. What you're going to do is you can cap this needle. All right. And then now you're done. And then what you're going to do is you're going to switch to the needle so that you can now administer or inject. And so with next, I'm going to have you open the needle there, the injection needle. Remember, this is a smaller needle.
Bottom, right?
From the bottom, right. It has a word label here, open here, for packaging, opening the package. All right. Should be, just think of it as it should be a smooth process.
And so obviously not touching where it's going to connect.
That's right. At this time, what you want to do is you are going to switch the needles so that you have this. But before you switch the needle, remember, you are now having a little bit of the volume up here. So what you want to do is before you do that, you're going to pull just a little bit down. Right there, so that then now you have this kind of a little bit of a bubble here. Now you are ensuring that this is now completely empty, right? So now it's empty, then you can now remove the needle. Yeah, so then if remember, you try not to waste anything. Yeah. So go ahead and now twist, yep. Okay, and now as you are putting on, so I actually also very like that you actually didn't pull it out altogether. Keeping things sterile is still desired.
Okay.
Sounds good. Right.
And this is the hardest part for me, so I'm glad you're here.
Yeah, so you see that there. So now what we're trying to do is we try to get the volume all the way up to the very tip of the needle, right? Okay. You actually don't want it just to kind of get here, because because the thing is, if you don't get it to the very top of the needle, technically this is a big bubble.
I was doing that for way too long because
all right. And so if you are scared about smaller bubble, that was a bigger scare. All right.
Yes.
Right. So and you're okay with it, right? You know, so therefore, you know, there is some leeway around bubbles, you know, in terms of how small they are. And so here, what I'd like you to do is, you know, as kind of even as possible, right? Maintain a kind of upright position, and then you're going to push up slowly until you see at the very tip of the needle a bubble.
Go slow, right?
Go slow, exactly. And it's very fine motor movement. So very slow. The goal is to try to push it all the way up. So when the bubble just shows up and not tip over. All right. And it's important to do upright, because otherwise you might actually create. There might be some bubble kind of created on the side. Check for bubble means just looking at it. Yeah.
Sorry.
Right. Do you see any bubbles at all?
There's a couple tiny ones in the orange.
Yeah, those are very tiny, and that's negligible.
Okay.
Nothing to worry about, right? We're talking about like big bubble that you would be able to see that would consume lots of volume. This is good.
Okay,
yes,
awesome.
That's completely okay. So before injection, put the prep syringe down, and you are going to prep it with the space. So first identify your location where you're going to receive that at. So this is now the right lower abdomen. I highly recommend locating it by using a pen. I like this tip a lot because so this is kind of a pen, right? And see if you, where would you like to put it?
I should go like here.
Right here, right? So make a pinch, and so then what I usually do is just do this, and then it gives us there. So even then, when you start wiping the cleaning area, it's still there, and so you're not missing a location. So it's actually, especially for first timers, people get really kind of like where should I be putting it and all that. So this really allows for reminder of where you locate it.
And could you remind people where else they could inject subcutaneous besides the stomach?
Yeah, the stomach location is preferred mainly because it's easiest for first self-administering. So yeah, so this area here, the abdomen here is the subcutaneous space that you can easily access because mostly when you pinch it, okay, essentially you will have easy access to the space underneath the skin, which is subcutaneous. And so whereas other locations like the arm, where you could do it like right here, or even here, it's an okay thing when a person is helping you, mainly because it's harder to self-inject that way. So this is preferred, and it's probably the easiest because then you have good leverage and also good access without kind of messing up. So the next step is now after you locate it, you're gonna open up an alcohol pad, and then you're gonna wipe in that area with kind of the periphery, maybe like 1 inch around it. Yeah, or exactly. Make sure that it's completely on kind of onto the surface because you want sterility. There's a lot of bacteria that can live on the skin, and you don't want to kind of insert it.
Wait for it to dry.
And yes, it's important to wait to dry. Thank you for that. Next piece, I like to also prep the Band-Aid as well. Okay. Also make sure that there's a slight chance that it could bleed. So also have a cotton ball with you. How I do it is I open halfway, and then I place it like almost prep for it, so that once I inject, I immediately close it.
Okay, yeah, I didn't know that either.
Like that, yeah.
Okay.
Yeah.
That's smart.
Okay. Right?
You know what you're doing.
No, it's okay. So then
I'm learning so
that's
much.
it. So the next piece is now hold it, and then maybe again, if you're struggling at the beginning to kind of like what is the best kind of a way that I can press, because keep in mind that this is a viscous solution, so pressing it requires actually slow motion. It actually may take a few seconds to even kind of go in. It's not like as easy push. So just keep in mind that you also make sure that you have a good leverage.
You don't want to adjust your grip once it's in you.
Correct. Right? So you're right. So it depends. If you're adept and skillful, you can just use it one way. But sometimes people do have to kind of switch. So how do you find yourself? Do you find yourself pushing in and then find the right position?
I try to find it before.
Okay.
Even just by there, and then. Yeah, you're right. I think it's probably better to find it before, and then just so that you just have one position. But some people do kind of like insert it like this, like they hold it this way. They insert it first. They insert it first, and then you can actually hold it this way so there's more stability, and then you press with this way. So this is one position. Or how you do it is, I just don't have, for me, I don't have that much strength with holding it like this. So therefore, I have to then also switch, right? Once I poke in. So this allows me the most leverage. Okay. And then for you, how do you do it? Yeah, exactly. Like that.
But keep in mind that you still have to poke yourself 90 degrees onto the. Not
45.
So the good question. So if you're pinching, 90 degrees is okay. Mainly because the needle is already short to start with. Yeah, so 90 degrees is okay to reach the subcutaneous space, 45 degree is also okay, to reach the subcutaneous space. This is given because the needle is small. Small as in 5/8 of an inch or shorter. Sometimes it's given as half an inch, right? Half an inch is basically 4/8. So it's not that much shorter. But basically, it's anywhere between 45 degrees to 90 degrees. 90 degrees, again, is probably easier. I don't know. It depends on your preference, really. 45 degree is that way, right? Yeah, that way. Whereas 90 degree is just straight that way.
Yeah, I'm used to 45. I also don't like having my wrist twisted. So
got it. Yep. So both of those things are okay. Again, given the fact that first, the pinching allows for it to enter the subcutaneous space, and then the shortness of the needle also allows for that.
And then you always want to make sure the opening is facing towards
you. In the grand scheme of things, not as important because it's a small needle anyway. It's pretty sharp, especially single use. But it's important to know that. So yeah, exactly. So as you are now then you find the location, and then you are directing it onto the site and insert it. And you can insert it kind of steadily is the key. Yeah, and go slow. Steadily allows for control movement, right? And then also doesn't disrupt kind of the surrounding structures.
And then
time to push, your hands might be a little bit shaky in pushing it, especially when you use like an index finger or something. So just kind of really make sure that your hand is firm to hold both the syringe and the ability to kind of push it. Ensure that everything is entered, then you pull it out directly straight as you enter. You're not moving any of the needle inside there, right? And then you put the battery back onto that.
That makes sense. Last step is to make sure you dispose of your sharps correctly. You can put them in a container like this one, or even a different kind of container like a laundry detergent one like this one. My friend Natalie, shout out to Natalie, gave me some extra tips. Dispose of your container when it's 3/4 full, just in case if it's too full, you could poke yourself on something. It's best to be safe and just dispose of it when it's 3/4 full. You can put other household sharps in these containers, including broken glass, staples, nails, bone fragments, pins, knives, etc. No band-aids, no cotton. If you want to get a free one, you can go to nasen.org, nasen.org, or through your pharmacy. Like I said, if you don't have a sharps container, you can use something that's like plastic, like the laundry detergent one that I'm going to be using. There was a couple questions when to call a doctor.
With any kind of injection, there is a risk of skin infection. As I mentioned before, there could be a port of entry where bacteria can go in, and that can then lead to a local or site infection. And some of the signs are redness around the area, induration, which is kind of hardness around the area, and then also swelling. Pus formation can happen, so usually in that area. So it's not going to migrate, in terms of the infection. But if there's an immediate infection, it should be kind of around there. Generally happen the first few days when you first do the injection. So swelling, redness, pain, discharge, those are all signs of infection where you need to go to your provider to get care, likely antibiotics, maybe wound care, those kind of things.
What about blood?
Yeah, blood, when it's a normal process when you inject into any area, mainly because there's blood vessels everywhere, and so blood is common. Don't be alarmed. But if you continue to bleed as a result, that means you use your cotton pad to stop the bleeding. It should stop bleeding within like 5 minutes, right, or less. But if it's continuing to bleed, that's when you might have hit a bigger vessel, or you might have forgotten to switch your needle, and you got in a bigger needle stick. So that's also may have happened. In those cases, even this is what we call primary intention. Like when you do that, it should even kind of heal on its own. It should clot on its own.
And even then, the bubbles, we're not risking a heart attack if we accidentally hit a vein.
Right, exactly. When you hit a vein, basically what happened is a vein or any artery there. First of all, subcutaneous space kind of really avoids that already. If you happen to hit it, it could bleed kind of locally. So it may appear as a bruise, right? Like,
but it's not life-threatening or anything.
Correct. Yeah.
Okay.
Yeah.
Cool.
So again, you see a visible bubble that you didn't attempt to take it out. There is attempt of getting into kind of the bigger vessels, but again, the space does already kind of minimizes that already. You're also not going directly onto a vein that is important, right? So these are important veins, like hand veins. Here, the other veins are much smaller in nature, and then if it's bleeding, it's actually more of a rupture, bruising.
Okay, cool. And then the last thing I remember you said to just try not to shake your estradiol, because that's what will add more bubbles.
Correct.
Be gentle.
Exactly. Be gentle when you do it. Just kind of gentle, like movement up and down. Don't shake or reconstitute. It's already kind of reconstituted, meaning that it's already ready. And so all you need, the only up and down that you need to do is just kind of like gently go down, so that then you can insert your needles. The other piece, which I find helpful before the injection, is some people actually apply an ice compress. So ice compress really allow for numbing of that area very quickly without any agent. The numbing then allows for actually no pain, especially when you are not necessarily like injection.
Before you clean it, you would numb it.
Exactly. Exactly. Just in that area. Yep. Space. Subcutaneous space is referring to cutaneous is skin, right? And so and just right underneath the skin. And space
and some people do thighs too, right?
Yes. So exactly. So depending on the body habitus, the thighs can be like body weight and body structure. Some people have actually kind of adipose fat tissue there more, and so therefore also bringing this up and actually doing it like right here with the exactly this pin. But actually, as you're pinching, you can see here that this is already kind of subcutaneous space. You can actually do that. That's into there too.
Okay.
You know. Cool. I see. Good question. So intramuscular, I would say that the needle are generally 1 inch and or greater. So it's 1.5 inch is 1 inch to 1.5 inch.
And then is the bubble thing the same there?
Correct.
Okay, and then there you're just going
You're going straight down.
There's no
at 90 degrees. Yeah, 90 degrees only.
Okay, and you go
for intramuscular spaces. The recommendation for self-administering is more lateral thigh. So like right in this area here is safe, right? But also mid thigh. Remember, this is the location is specifically here because you are trying to avoid nerves and other structures that could be damaged by injection. So this is a safe space. I said this is the middle third is a good space. Middle third, lateral thigh.
And is there any advantage or disadvantage to doing one versus the other? Is it just a preference thing, or why would?
Preference, actually, comparisons of the two, the same effects actually have been observed.
Thank you so much.
Of course.
I really appreciate your time.
Yes.
I think this will be very helpful to a lot of people. Thank you so much for watching. If you have any questions, leave them below, and I'll try to get them to Tim. Maybe I can shoot you an email if I have more questions.
Absolutely.
Thanks so much for watching. I hope this was helpful. The idea behind this was to make a video that I would have wanted to see when I first started, which means that it is really detailed and answers all the little questions that give me anxiety. Anyway, if that's you or you're new to this, I really hope this was helpful. Thanks so much for watching. I'll see you next time.